But basically you can choose one of the different massage heads. This head is my favorite for working with acupuncture points, and you can use this specifically on distal points before you actually massage the direct area. So you could do it on certain areas of the body, distal points, and then you can treat the affected area. I've turned it off again, but the unit is not off completely. You have to turn it off by turning the switch at the bottom. So, nice for acupuncture points, distal. You have heads for working along the spine, broader areas, flat areas of the body that you want to work with. If you want to go deep into gluteus muscles, you can use the ball head, the small ball head. So these are yours for experimentation and playing, and we'll do a little demonstration of some techniques that I've worked with. Okay, so I'm going to do a little release, and I want to show you some tricks that I learned practicing with the gun on some patients. You turn the device on, take it to the speed that you want. I'm putting it at the fastest speed. Now, when you introduce the pulsating head to the tissues, you don't want to go in real fast. And you always have to be monitoring the pressure that you're putting so that you don't create a clunking sound. When you go too fast or too deep, you'll feel like a clunking and it'll be uncomfortable for the patient. So you have to introduce the pulsing very gently, very superficially. And even at that superficial level, you're creating a fascial wave traveling through the fibers of the muscle. And what I found is actually really useful to do is actually to gather the muscle as best you can. And when you gather the muscle, you can then press harder into the gathered muscle. Don't try to do that when you're just introducing the pulsations superficially like this. Don't push them too hard. Go to the comfort level of your patient. So I'm working the infraspinatus here. And as I gather and I bunch up the muscle here, now I can also introduce. And you can see that there's a redness coming up because we're heating up the tissues and increasing circulation very quickly here. You can also have the patient do some range of motion, so they can passively, or I can do the movement, or active range of motion where she can do the movement. And again, what that does is it helps create a kinetic chain and releasing the fascial connections throughout the whole region. Isn't that beautiful? So again, you see, watch how I gather the muscles, and then I can then introduce the gun with a very strong pressure. And that feels really comfortable to the patient. In fact, it feels so good, they want to have more. If I just do it like this, it's not as comfortable and I can't go as deep. If I gather the muscle and then I press, it's very, very therapeutic and very releasing. So you can work the tissues in this manner, creating a nice fascial release. So I'm still using the acupressure type of unit, and I'm going to change that now. And so again, I'm going very, very gently, not introducing it too hard, until I find the right level that's comfortable for the patient, and I'm getting the pulsations and the vibrations that are occurring through the kinetic chain of muscles. So now I'm going to grab the QL here, and I can work that a little bit deeper by bunching it up and then pushing. You can experiment with different heads for different purposes. More specific with the finger-like massager, the fascial plane of the muscle, grabbing the tissues, pushing into them. Doing active, passive range of motion, active range of motion, and then again gathering and then working and going deeper into the tissue. And that's it. This is a great tool that you can use post acupuncture treatment, and again to liberate all the fascia, to increase circulation, and I hope you enjoy it.